We're all? Okay. Good morning, everybody. To welcome you and to the Cook County Public Health Human Services Board. I'd like to call the meeting to order. It's Tuesday, August 20th at 8:30 a.m. On our consent agenda, we have our meeting agenda, minutes, financial report, abstracts and bills, and resignation. Would anyone like to pull anything from the consent agenda? Are there any modifications to our meeting agenda, or is there a motion to approve?
Mr. Chair, I'd like to move to approve the consent agenda.
Thank you, Commissioner Sullivan. We have a motion. Is there support?
Support.
Thank you, Frank. A motion and support. Any further discussion? Hearing or seeing none. All in favor? Aye. Opposed? Motion passes unanimously. Thank you. That brings us right on down to our staff report. And this morning we have report on harm reduction at Cook County. Both Andrea Orest and Brenda Port. Good morning. Welcome.
Morning.
Good morning.
I'm Andrea Orest, Public Health Educator with Cook County Public Health, and Brenda.
I'm Brenda Port. I'm the Substance Use Co-occurring Case Manager, and I also do treatment coordination.
And we are going to talk about our harm reduction, education, and outreach. Oh. Look at that. So when we talk about harm reduction, we talk about a few different things, and the why it's important to our community is one of those items. We look at data in our community as well as regional and statewide. It's important to note that in a small community, the data sets are so minimal that if we don't make a regional or statewide comparison, we really can't see, that larger picture. So in 2020 in Cook County, there were 7 reported incidents of non-fatal overdose and 6 incidents in 2021. And for some historical context, between 2016 and 2019, there were 2 reported fatal overdose incidents in Cook County. As we move out regionally and we look at Lake County and St. Louis County, in 2020 in Lake County, there were 14 reported incidents of non-fatal overdose and 18 in 2021. And then also, in 2020 in St. Louis County, there were 487 reported incidents of non-fatal overdose and 498 in 2021. And then for that historical context, there's data there for between 2016 and 2019, the 4 reported fatal overdose incidents in Lake County, and then for the same time period, 136 reported fatal overdose incidents in St. Louis County. So that sort of gives us that larger regional image.
So we just wanted to give you a good view of where we're going with opiates and overdose deaths. As you can see, Minnesota is steadily increasing. A large reason behind that is fentanyl and xylazine is coming into the market into opiates, and those are incredibly hard for people to get reverse medications. Xylazine reverse medications don't work. And here would be the non-fatal incidence of overdose. As you can see, it's steadily increasing. All opiates is going to include any over-the-counter legal opiate medication, as well as fentanyl. Fentanyl is just becoming a huge crisis in Minnesota. Heroin, it's a little misleading because heroin's going down because there's so much fentanyl in the drug supply. That's where that skew is coming from.
So when we talk about harm reduction, we talk about it being a recognized public health model that has been in practice since the early 1980s. And really what it does is reduce the harms of active drug use, including reducing the spread of infectious diseases. So harm reduction is a set of strategies and ideas that are aimed at reducing the negative consequences associated with drug use. And it's also a movement for social justice that's built on the belief that individuals who use substances deserve as much respect as anyone else in making their decisions. In May of 2023, some Minnesota laws went into effect that legalized drug paraphernalia possession. It also legalized syringe services, which is a service where you can exchange your used syringes for sterile syringes, which then helps reduce the spread of disease. And then it also legalized controlled substances residue and testing supplies. So those are testing supplies, and there is actually machines that you can use to test a substance before you use it. So that would be like the xylazine and fentanyl test strips, or there are machines that you can use also, and some harm reduction agencies are starting to acquire these machines so people can come and test their supply. And the goal is that if they discover fentanyl or xylazine, they would hopefully not use it and then prevent that overdose.
So I'm going to just add one quick thing, because we added a slide, but it didn't make it. So right now in the state of Minnesota, only 2 out of 10 people are completing their opiate inpatient treatment. Some of that is because they get on the MAT program, which is medically assisted treatment, and then they think that they're fine and they can go back to their lives. What I'm seeing as a professional that has a client load, while the MAT program is hugely beneficial to get those cravings reduced for the opiate, they're missing the mental health portion of treatment. So there's a huge relapse potential for that reason. So that is a huge issue for the state of Minnesota right now. So the harm reduction program that we use is a very non-judgmental approach. So we meet our people where they're at. I meet my clients where they're at. There's no judgment. There's no shame. This is all evidence-based. And I mean, I have an ethical obligation to respect the decisions made by that person, even if I know that they're going to cause harm to themselves. My role is to just make sure that they're as safe as possible and have all the resources they have to get the help that they need when they're ready.
Okay, so some of the strategies that we currently use in Cook County are education around safer use, and that is ways that you can use a substance to minimize the harm. We also talk about abstinence, and then, like Brenda referenced, meeting the individual where they're at and no shaming or judgment. We talk about addressing the conditions of use along with the use itself, such as housing, employment, family supports. You know, what sort of protective factors do they have in place to help build up their success? And what risk factors do they have that might sort of play against that success? And then connecting the individual with the resources that might benefit them. We're switched. I'm going to just do this one. So when we talk about examples of harm reduction strategy, harm reduction is a highly cost-effective strategy, and it has been shown to save money if you look at it through the aspect of prevention. You know, the more prevention you put in place, the less health effects and therefore healthcare costs come later. I talked about the sterile syringe services. We distribute naloxone, which is the opioid overdose medication, and that is the injectable version, so it comes with the syringes and a CPR mask. And we also have leave-behind kits that have been distributed to a lot of the agencies that are really that first point of contact for people who use substances, and those include the naloxone and the sterile syringes, also a resource card that have local and regional resources, the CPR mask, and then we also include fentanyl test strips.
It should be noted that Cook County and Ramsey County are the only two counties that are currently giving leave-behind kits for their personnel, like fire, ER, police.
Yeah, and they're going fast. Like, I've, dropped them off at these places multiple times, and we started in the beginning of summer. So we are looking to expand that to more of those first point of entry organizations. We also have Narcan, which is the nasally administered medicine that reverses an opioid overdose, and that just comes in a box with the 2 doses, and then there's a CPR mask taped to the top. And all of these supplies are presently available in the Public Health and Human Services lobby. The cabinets that we will be moving to the restrooms in the courthouse have arrived after ordering them 3 times, so they can be put together and put in use. So that will just provide greater access to people. We received some feedback that because there are cameras in the lobby of the Public Health and Human Services office, it made people nervous, that they were being watched or, judged or whatever. And through all of this process, we are also learning from Grand Portage Human Services while they work toward the installation of 2 harm reduction vending machines. We talked about the fentanyl test strips, so they are available for people to test their supply before use. We also have the xylazine test strips. And then Brenda referenced the MAT program, that's that treatment program, is available at Grand Portage Health Services and Sawtooth Mountain Clinic for people to seek treatment if that's part of their plan.
They currently have 17 patients on their load. Oh, there you go. Questions?
Thank you. Very, very fast report and to the point, and boy, is it depressing, but oh so important. So thank you for the work that you do and sharing it. And one of the things that caught my attention was just adapting to the feedback that you're getting from our community, right? Like, we're trying to serve our community, and if they're saying something, then you're adjusting and adapting. So I really appreciate that tact as well. Any questions for Andrea or Brenda? Please, Frank.
I have a few, thanks. I would assume that the overdose figures would all be funneled through the ER. In other words, the ER, then it goes up to the state, and then it goes up to, and then comes back down. Is there any way to get more current figures than 2021 just by calling the hospital and say, how many overdoses did you treat in 2022 and 23?
So the overdose data doesn't only come from the emergency department. I received a very comprehensive email from the person in MDH that oversees sort of the overdose data.
Yeah.
And it actually comes from a lot of different places. But we, surprisingly, through the cannabis regulation conversations, we've been talking about, how do we collect that data in more real time?
Mm-hmm.
So we are having conversations about that. It's just a matter of how we can access that in a confidential manner. Because, in a small community, if one person goes in because they had a fatal or non-fatal overdose,
Mm-hmm.
And they say one person came in on Tuesday, we would very likely know who that is, and it's no longer confidential. So,
Sure, but aggregated data for the year, what we
Right.
had 12, if we had none.
Yeah.
You know,
yep, yeah, so we are trying to figure out, how we can access that data more locally while maintaining that, level of confidentiality that is
okay.
important.
And the other part of that question was, is this based on the residence of the patient, or is this based on the place of the incident?
Place of the incident.
Okay. So.
Oh, are you asking about the overdose data?
Yeah.
Yeah.
That data is resident data. The data that I put in the slide for 2020, 21, that's resident data.
So anything we get from dispatch is county data. It's any 911 call. So you don't have.
Which would include
Yeah.
non-residents.
Yep, correct.
Right, but the data that comes from the state, they only put resident data.
Okay. Now, the dispatch data, again, I'm an EMT, so I get the dispatch calls. So that won't tell you there's an overdose. It'll tell you there's a patient unconscious,
Right.
something like that. But how is that parsed out? There's lots of reasons why that 911 call would come in that
Correct.
wouldn't be an overdose, and lots of overdoses that wouldn't be obvious from the call.
Which is part of why the numbers, I don't want to fixate on the numbers.
Okay?
Because there's also a huge level of my clients that within their own social group, people are overdosing and using Narcan and not calling anyone.
Understood.
So
Agreed.
I don't really focus on the numbers that much. I focus on what my clients are telling me.
Okay.
Yeah.
And is there any difference in the Narcan versus the naloxone, the nasal versus the injectable?
Only the route of administration.
Okay, so the effect is pretty much the same.
Yep.
And my understanding from my training is that it'll last about 15 minutes, and then you might need a second dose, which is why they come packaged
Right.
two.
And, a lot of farther out areas are finding that, because of the high levels of the substances that people are using, sometimes you need to use more than two right away.
That was my
You
next
know,
question.
So,
'Cause we're taking people, it takes an hour to get to the hospital.
right, yeah, so it does eventually wear off, so what it does is once the medication hits your brain, it kicks the opioid off of the opioid receptor in your brain, and that, like you said, is only for a short time, maybe 30 minutes tops. So that's why it's important that even if somebody comes out of it and starts breathing again, that they hopefully get follow-up care, and then if somebody uses their supply of Narcan or naloxone, that they, replace it.
A very disturbing trend that I'm finding in some of my clients is it's not uncommon for stories of 5 or 6 naloxone injections
Whoa.
because of the fentanyl.
And the layperson would know when to administer an additional one by observation, the guy's still out? or-
Well, because people literally, they'll come to,
Yeah.
and then they'll go
Fade
back
out.
out. Yep, the respirations will shallow again, and it just becomes yeah.
Okay. So, Andrea, right? So in addition to, and it's a great program, let me just, I know I'm asking a lot of questions and
No,
trying
that's
to probe,
great.
but this is not at all in a critical way. This is great. Along with the availability of these harm reduction drugs, and needle exchange and all this kind of stuff, has there been much health education messaging
Yeah.
to the people? How do you use this?
Well, I
When do you need
realized-
to put another one? Yeah, it only lasts 50 minutes. Yeah, when that person wakes up, he might just come up nice and rosy, but he might come out pretty combative because he didn't want to be waking up.
Well, right, well, and part of that is, they go through immediate withdrawal symptoms, right?
Yeah.
So I skipped on one of the slides. We do collaborate with Cook County Higher Ed every month when they do their CPR and first aid training. Rob Wells does an add-on Narcan and naloxone training, and that portion is at no cost to the community. So you can just go to that training, or you can, if you're already in CPR and first aid, you can tack on that 1 hour naloxone and Narcan training. And when we put out the instructions that come with the medications, talk about that a little bit, but, you know, I think in the world of public health or anywhere, you know, more outreach and education is always our goal. So I've done some WTIP and Boreal and social media sort of education in the community throughout the year, and some of them have been on Narcan and naloxone. But, you know, we're always talking about how do we reach more people, because,
Yeah.
you know, you could put something in all of those places that you think, okay, I did it all, but then there are still people who, you know, didn't hear about it or didn't know, or, yeah.
Yeah. One of the principles that we use is the just in time. Give them the information when you need it.
Right.
And that would be right with the package of the Narcan.
Yep.
However, and I realize it all comes with that. No, if my friend is sitting here unconscious, I'm not going to take time to read that package insert.
Yeah,
which
well.
I can't see anyway. 'Cause my
Right.
eyes are- okay.
Yeah.
All right, so just like a one-pager with 5 or 6 bullet points
Yeah.
wrapped up around the package,
Yeah.
that might be
I like that. That's
very
good.
helpful.
So one of the things that I mean, sort of oddly proud of in my client base is, there's a lot of folks that when they sell this product, they have someone safe there that knows how to use Narcan or naloxone. So these folks are using, and I mean, they did that themselves. I guess it's a selling technique. So it's frightening, but that's been that's what's happened in Hennepin County and Ramsey County for years and years, is there would be like a safe person in one of their houses that they sold. So as scary as that is, for me as a professional, it makes me feel a little bit better.
That's very good. It's part of the non-judgmental thing, you know? and
Yeah.
You realize that it happens. So then what are we going to do about it?
Commissioner
Thank
Mike,
you.
Did you have a question too?
Could you, fentanyl kills, so how come we have so much of it? I mean, what, could
No,
you
that's a good-
go back a little tiny history of why did fentanyl get injected into the, if you're gonna buy speed or whatever you're buying?
Yep.
How did that get there? And knowing what seems to be pretty apparent these days, even from not being part of a drug partying crowd, that you could die. I mean, I get that younger you took greater risks, but, you know, like, yeah.
So that's a great question. So the first answer is fentanyl and xylazine are incredibly heavy. So when someone who sells a controlled substance, they cut it, you call it, and they used to use like baking soda back in the day.
Yep.
But fentanyl and xylazine are incredibly heavy, and everything is sold by weight. Then they figured out that fentanyl and xylazine also give you a wonderful euphoric feeling, so it just added to the fun, I guess, or the experience. And so that's the main reason why it came on, is just because it's heavy and it was cut and it just made sense. You can buy xylazine online. It comes from China. And it's an animal tranquilizer is what it officially is. Fentanyl, we know, was a drug for years for surgery and those kind of things. And so that's why fentanyl came in. But
Isn't it so that also part of the problem is you don't know what's in there?
Correct.
You think you're buying
Correct.
some opioid, heroin or something, and fentanyl has been added, but there's no warning label or
Correct.
product ingredients. You don't know that there's fentanyl in there.
Well,
You just know it gives you a good eye.
And the other very real, very scary thing is when someone is producing pills, like, you know, an opiate pill, there's no exact measurement of how much fentanyl. So Andrea could take a pill from the same batch and be fine. I could take the pill right next to it and die because it was all fentanyl. So there's no magic recipe for any of this. That's part of why it's so scary.
Oh, Commissioner Johnson, please.
Yeah, thank you. So I understand the rationale for the non-judgmental approach and trying to get people help that they need. I'm wondering about the impacts to families, and especially, you know, children in the household. How do you work with the families to prevent the spread of more addiction?
That was part of why I was so passionate about the Leave Behind kit, so everyone in the family was educated that if they had someone in active use in their family, they knew how to save them. Because as traumatic as drug use is, it's exponentially more traumatic to watch one of your family members overdose and die. It's a horrible death, which is why the Leave Behind Kids is, I'm so passionate about that. When I get a client that has children, I immediately make that referral to Children's Services. Lots of times Nancy and her coworkers are involved to do PSOP training and parenting training for folks. I get people into treatments that take children eventually, like if they'll go in for like a month and then they take up to 10 years old, so the kids can be with their mom, so they're not away from mom for a really long time. So we try to do what we can to mitigate for the family.
So of your clients that you currently have, how many are actually going to treatments like that? Do you have an idea? I just never heard of that kind of treatment
So
before.
Recovering Hope in Mora is the biggest one.
Covering hope?
Recovering Hope, it's in Mora, Minnesota. My biggest success story graduated from there, not mine, but my client that's been the most successful has graduated from there. She's got a full-time job. She never lost custody of her daughter. She's doing phenomenal. She's also in the MAP program, and I see her once a week.
That's good. That's good to hear. Thank you.
Yeah, absolutely.
Commissioner White, did you have another one?
If social services is aware that there is drug use in a home and there are children, what is besides handing out harm reduction and intervening that way, it seems like probably not the best place for a child to actually even be.
So the Minnesota Department of Health and Human Services is very clear that drug use is not a reason to take someone's child. They have to show harm to the child. So that is why Nancy's team becomes so hugely important. My client is the person struggling with substance use, and then Nancy's team, as well as the children's mental health team, is involved. And we do what we can.
Can you give us an idea of the size of your caseload in Cook?
I currently have 27 on my caseload.
And those are current active users, would you say? Or
No,
not all of them? Okay.
no, I would say out of the 27, 4 are in active use right now that I'm trying to get into treatment.
Thank you.
Yep.
Commissioner Sullivan?
I just want to thank you for all the education and outreach you already provided to our community, both through Cook County Higher Ed presentations at the community center. You've done an outstanding job and continue to let us know how we can support that effort. You're making great strides in our community.
Commissioner White?
So is the school, I know it's all confidential, but is there an avenue of communications with the social worker, with the administration in the public schools to alert the powers that be that a particular child might be having some problems at home?
Yes. We get referrals on a weekly basis from
But
the school.
do you give them does it often work the other way where you come into a situation and do you confirm with the school that this child is getting special attention, or they have eyes on the child because you have found out about drug use in the home that perhaps they did not know of?
I do not personally. I know John, my supervisor, has weekly meetings with folks at the school, and I don't know what they talk about at that. I would have to have a release of information to do a lot of that, so I can't reach out to the school and tell them that an adult is using in a home.
Or to
No.
just be vague and say, oh, okay.
Nope. I have very, very clear boundaries about what I can do and what I can't do.
Please, John.
Child Protection Team has a monthly multidisciplinary meeting with the whole community. And in those meetings, we are statutorily permitted to talk about families that are at risk and to allow that coordination. So that would be one mechanism for us to be able to share that information and still maintain confidentiality and respect of privacy for everybody involved. I will clarify, I do not meet with the school weekly.
Oh, sorry.
Only about monthly. And we are working to establish that relationship and form better methods for communication, because they struggle with these same issues that we struggle with. Everybody's really busy, and the worst time to start having those conversations is when the crisis is in play. So we always want to try to get in front of that as much as we can, and so we're trying to figure out how do we do that, given everybody's, significant need.
Thank you. I think I've told this anecdote before, but some of my past and current circles are in the restaurant and bar industry. And there was an individual that I was talking with who bought a test kit, and this was, I guess, before the law was passed even, but just because they were seeing friends die. And so made that widely known, right? And there's often like either use or maybe after work use or whatever. And so this person would be testing things. And sometimes it would be somebody, oh, I just got whatever drug, and then they would test it. And I think they said something like 9 times out of 10, it was all meth. They never found fentanyl, but it was never the case that the individual buying the substance was intending to buy meth. And it was just a really interesting, strange, and that's not, we're not talking about meth per se today. Fentanyl is what's killing a lot more people now. But it was just a really interesting anecdote about the test kits and what they can tell you. And just wanted to share that. Okay, any other questions, comments? Thank you very much for the education and continued education. And
Thank you.
Thank you.
yeah, have a wonderful rest of your day.
Thank you, Andrea and Brenda, for your report, for your leadership in this space. It's pretty remarkable to think back just a couple years. Harm reduction was hardly a part of our vocabulary as a department, as a community. Now we're achieving distribution widely throughout the community with partnerships like Cook County Higher Ed. I see Karen's here, so just really grateful for both of your work and for everyone else who's been a part of this effort.
All right. Our next item on the agenda is our director's report, and starting with staff updates.
Thank you, Commissioner. Good morning.
Morning.
I've included an updated organizational chart in the meeting materials. Changes since our meeting in July. Rocio Rivas has transitioned from her role as office support and case aide to the public health team as our new public health educator, youth prevention specialist. So another key asset to our work in this area going forward. Rocio will be working really closely with the schools, other youth serving organizations. She's deep in her training right now, and just really grateful to have Rocio in that role. We interviewed last week to backfill the vacancy created by Rocio's promotion. We had a really excellent slate of candidates for that position, and offer has been extended, so we're hopeful to have a recommendation for hiring at the next regular board meeting. And given the range of very qualified candidates that we interviewed for that position, hopeful that we can refer some of those candidates to other vacancies within our team. In terms of positions that we're actively recruiting for right now, the Children's Mental Health Case Manager has been reposted. That is backfilling Marissa Chapman's role following her transfer to the Adult Services team, working on disability case management. Our in-home support coordinator position, an offer has been extended there, and again, we're waiting on the Department of Human Services licensing to agree with our hiring decision on that position, as it's the state oversees and licenses that program. On the consent agenda today, you accepted with regret the resignation of our Children and Family Services Supervisor, Rachael Schauer. I just want to take a moment to express my gratitude and recognize the great work that Rachael has done in her short time in that position. She has done some incredible work to build in really critical infrastructure and support for the team around tracking all of the mandated requirements, notice requirements, follow-up, especially as that caseload has increased dramatically. So really grateful, again, for all that Rachael has done and that she's positioned us well to bring the next person into that role and be successful. Again, Rachael, as indicated in the item for board action, is committed to stay on board until we fill that position and have someone trained in. So our intent with backfilling that supervisor position is to post this week. Likely that position would close on the 30th. We might receive a list of candidates the week of Labor Day, scheduling interviews for mid-September. So our pretty aggressive estimate in terms of interviewing for that position, or for a start date for that position rather, would be early October. So looking at a pretty similar overlap as when Grace retired and Rachael started last October, that we would have about 3 months for those two to work together. I've included in the item for board action related to the Children and Family Services staffing request that we're anticipating a minimal expense for that period of overlap with 2 supervisors in that role during the training and transition period, with very significant benefit to the incoming supervisor, to the team, to the families that we're working with, especially given our workload where it is right now. Also hopeful to post for that additional Children and Family Services case manager yet this week. I'll hold off on detailing that request until we move into items for board action. But again, see the benefit of recruiting both for a supervisor and a case manager at the same time, and that Rachael would be present to help onboard that new case manager, pending board approval of that addition of FTE. Any questions on the staff updates before I move on to department updates and items for board action?
Looks like not.
All right. It's been a really busy month for us. One of the big projects underway has been submitting a grant application to the Department of Human Services for the 2025-2026 Mobile Crisis Grants. As I reported earlier this month in our special meeting, the budget presentation, Cook County, through the Arrowhead Behavioral Health Initiative, is applying to be a crisis grant recipient starting in 2025. Currently, HDC, the Human Development Center, is the recipient of that regional crisis grant, and that includes Cook County and Grand Portage service areas. That service, however, is currently limited to after-hours, holidays, and weekends. Those are the hours that HDC is staffing mobile crisis response, with that daytime response following 2 public health and human services. Grand Portage Human Services also has in place a parallel system to ensure that residents receive support from tribal human services personnel when they're experiencing a mental health crisis. Public Health and Human Services also has a parallel after-hours response, because both Public Health and Human Services and Grand Portage Human Services, in addition to the mobile crisis response, also need to have in place a system for responding to people who are experiencing domestic violence, child protection concerns, adult protection concerns. So there will always be a need to have some overlap for those other areas in which we provide support to residents. But our hope with applying directly for the crisis grants is that we'll have greater ability to assure that staffing coverage throughout all daytime, weekend, and after hours. As a Department of Human Services grantee, we will become certified to be a mobile crisis response provider and have ongoing sustainable funding for that program. Right now, the position is supported with grant funds. So if we are receive or awarded this funding, that position would be fully funded through the grant. There are very significant infrastructure developments that need to happen over the course of the next several months to be certified to provide this service. Development of many policies and procedures. We have the benefit of having a 245G licensed program in Wilderness Outpatient Treatment Program that has some similar licensure requirements, so we anticipate being able to adapt some of those policies to the mobile crisis program. One of the other key components is having an electronic medical record in which to document our work providing mobile crisis services. We are in contact with vendors right now and included that full expense again in our grant application for 2025. We are also looking at moving over our substance use disorder program electronic medical record to the same system, as we have some issues with functionality with that system that we've had for Wilderness Outpatient Treatment Program for the last 10 plus years. Issues with integration with state systems, with integration across the clinical and billing sides. So we are hopeful that with this investment in a new record system for mobile crisis response that we can expand the use of that across other areas of the department. I do anticipate moving forward quickly with contracting with that vendor for the electronic medical record once we receive notification of our award from the state. So that's something that I'll be working closely with our chair on in terms of getting board approval to authorize that expenditure and move forward with contracting with the vendor.
Awesome. Thank you. Getting after it. Just one thing that caught my ear as we were talking about the crisis response worker, and that's a grant funded position, and then this will also be grant funds. And so the difference being the current grant funding for the crisis response worker is expected to end, right? We know when that'll end versus the mobile crisis response grant funding is almost more like an allocation, right? It's a recurring, it continually, versus our current end of the grant funding for the position. Is that?
That's a pretty nuanced picture, but yes, we
Okay.
currently have $140,000 allocated this calendar year through the Arrowhead Behavioral Health Initiative towards that position and the pilot overall. Right now, those funds are going to support some of John's time in providing the mobile crisis response service as that position is vacant, towards some of Andrea Orest's time as she's doing a considerable amount of work in that keeping things moving forward with the convening local partners, infrastructure development. It's our understanding that we cannot carry those funds over into 2025, and you are correct, Commissioner, that with this biennial grant from the Department of Human Services, I would equate this more to some of our allocations or block grants that offset the staffing expense, rather than a competitive grant, although it is competitive.
Yeah, and I was just in the Children, Youth, and Families implementation team meeting, and they were talking about the state systems, a lot of them moving over to more allocations than those grants, just because it's getting blurred as far as the grant and if it's recurring or not, and just those end dates. So that's why my ears were kind of tuned for that. But thank you.
Absolutely. Last week on Friday, the Deputy Commissioner of the Minnesota Department of Health, Wendy Underwood, was on site to meet with staff within our department and service and healthcare providers throughout the community to learn more about our unique local public health model here in Cook County, our staffing and partnership model. It was really nice to have the commissioner on site. Several of you all were in attendance there. It's just a reminder of how fortunate we are in this small remote corner of the state, that we have such great relationships across entities to be able to support our community.
And I just, my impression was that Deputy Commissioner Underwood was very impressed with the attendance and our local team, and just like the involvement and the firepower that we bring to the table, the coordination between the different groups. And frankly, I was really impressed with Deputy Commissioner Underwood and her willingness to come up here and meet the team and share directly the intentions and views of the department and the strategies. And yeah, it was a really great meeting. So thank you for facilitating, coordinating, and being part of that too with the whole team. Yeah.
Well, all credit to Grace,
Grace, yes.
who did all of the coordination and invites, but thank you.
I'd like to second Commissioner Mills' comments that the Mr. Modesty prevents her from expressing how impressed the commissioner, the deputy director, I guess, was on many of the different aspects of the county's public health and human services administration and function. So thank you. And it's been recognized, and I think everybody here should know that.
Thank you.
You're doing a great job, and all your staff, of course.
Coming up, we will have more assistant and deputy commissioners from the Department of Human Services and the Department of Children, Youth, and Families coming to the county in late September. They will be meeting in Grand Portage at the Lodge and Casino as a part of the Human Services Leadership Forum, which is a group of elected officials, human services leaders from tribal nations and county agencies across the state. I have served as a part of this Human Services Leadership Forum as a County Human Services Director appointee since 2020. Grand Portage Tribal Chairman DeShaw and Human Services Director Jackie Kozlowski are also members of that leadership forum. So grateful that we will have another spotlight on our partnership work across governments in Cook County and Grand Portage on that September 27th meeting of the Human Services Leadership Forum. I initially invited Commissioner Mills as our PHHS Board Chair and Commissioner White as the District 1 Commissioner. I will be sharing that with the full board as well if anyone else is interested in attending from the Public Health and Human Services Board, and we'll get that noticed on our September 20th agenda in case we have a quorum of commissioners present. My last update is good news from the Human Services Performance Management System. This is a arm of the Department of Human Services that's tasked with assuring certain performance standards are met across all counties in the state of Minnesota. In late July, we received the Child Safety and Permanency and MFIP DWP. Those acronyms are the Minnesota Family Investment Program and Diversionary Work Program, the cash assistance for families. That report indicated that Cook County is meeting or exceeding all performance standards across the areas measured. So I share that as significant, that despite our huge increase in workload, our significant staff turnover, limited resources in our community to support families in stress, that children and families in Cook County are more likely to experience economic security when exiting cash programs, and children in placement are more likely to be in relative care. Every child in Cook County with a substantiated maltreatment report in the last 5 years has not had a substantiated maltreatment report within 12 months. Pretty remarkable performance data, and again, all credit to our staff for doing great work. supporting families and children. Any questions before I move into items for board action?
Big wow, and thank you, staff. I'm still taking that in. Thank you for sharing that. I don't have a question. Anybody?
Well, if you'd like, Commissioner, I can just walk us through each of the items
Yeah,
for board
yes, please.
action, detailing the supporting information that was included in the agenda materials. The first item for board action is to approve recommendations for public health grant funding for 2025. The Public Health Fund Review Subcommittee, which is a subcommittee of our Public Health and Human Services Advisory Council, recommends granting $190,000 to 11 local organizations that serve a public health purpose in the community. The summary and synopsis of grant requests for 2025 was included in the agenda materials. The total requests that we received this year were amounting to $253,679. To be considered for the Public Health Fund, applicants were asked to align their requests with goals identified through the Community Health Assessment, those goals being affordable housing, mental health resources and support for well-being, affordable quality childcare, transportation options, affordable healthy food, and physical health services. All of our application materials, recordings of our open house, the request for proposals, all of that is published on the grants page of the Public Health and Human Services website. And just a historical context that it was the 2018 grant year that the Cook County Board of Commissioners, so in 2017, that the Cook County Board of Commissioners granted authority to the Public Health and Human Services Advisory Council to review and evaluate applications for county funding for those organizations that support our mission, supporting the health, safety, and well-being of our community. And that $190,000 is included in the preliminary budget presented on August 6th. For the department. That's line 231. I won't walk through each of the detailed requests. There's quite a bit of information there, but I can name each of the entities requesting funding and the amount requested. First being Birch Grove Community School, the funding recommendation there, $15,000. Care Partners of Cook County, the committee also recommended granting $15,000. Cook County Council on Aging, the funding recommendation there was $64,550. Cook County Higher Education requested, and the committee recommended granting that $15,000. Cooperation Station, the funding recommendation was for $10,000. Great Expectations School, $12,450. Hamilton Habitat was one of our new applicants as a part of this incubator program. The recommended funding amount for that organization is $10,000. Northwoods Food Project, another new applicant, $10,000. Violence Prevention Center, $18,000. WTIP, a new applicant, $10,000. And YMCA, also a new applicant, $10,000 there. I'll pause here and just ask that Frank or Commissioner Johnson, both of whom participated in that review subcommittee, if there's anything else that you'd like to add.
Commissioner?
Go ahead.
Okay. I'd like to point out two things. Number one, this is the first year that we've started this innovative program for people or organizations which have not previously applied. And I think it was very successful. As you said, we had various applicants and awarded funds to 3 of them. And I think they were all definitely right on with meeting the objectives identified in the community health assessment and innovative. And I think it was very successful. I'd like to see that program continue. The second issue I'd like to raise has to do with the Council on Aging, the hub. I've sat on the recommendation committee since it was established. And every year, the hub has been by far our largest applicant in dollar terms and has received the lion's share of the funds. And that's because they do excellent work. And I'm not at all debating that. That's why we voted to approve it. However, if the services that the hub provides are an essential part of what the county government offers and supplies to its citizens, I would suggest that this discretionary grant program, the discretionary fund, is not the proper vehicle to fund it. My way of thinking, that's for the extras, the things that would be really great for our community to have that advances these purposes, but is not an intrinsic governmental function. I have, before I got involved in this aspect of things, I have heard that the hub did receive direct line item funding from the county commission. I don't know if that's accurate. There's people who know that much better than I. But I would suggest that a more appropriate way to fund the essential activities, the essential governmental services activities that the hub supplies, is by a direct budget allocation by the council. Take it out of that, and that's my suggestion. Not a member of the council, but just passing it on for your consideration.
Thank you for bringing that up. I had heard discussions or ideas about this as well in the not too distant past, and I've yet to attend Council on Aging meeting, but I have an invitation to, and I'm intending to learn more about this and learn more about the history as well. It used to be it used to be a county run, and then it's not entirely clear on that whole transition and changes and all that in my mind, so I want to learn more about that, but I appreciate you bringing that up.
And just to give you an idea of the scale, the hub regularly applies for and receives 4 times as much funding as the next largest grantee.
Mm-hmm.
And typically a third to a half of the full amount of the funding.
It's a very strong point. Any questions from anyone about the recommendations
Quick
listed
comment.
here? Please, Commissioner Sullivan.
I just want to thank someone who's not here, Grace Granager, for the incredible work that she's done in putting together the process. I participated in this process a couple of years ago, and now Commissioner Johnson has. It's criteria-based. It aligns with our community health assessment, and it's a wonderful way to evaluate requests based on our community's needs. It's very direct. So I appreciate that. And Frank, I want to thank you for the incubator program, because we don't want to be just giving grants to the same people. We love the creativity, new ideas that are providing us with additional ways to reach out to our community and meet their needs. So thank you for that idea. It's fabulous. Great.
Thank you, Commissioner. Anybody else? Questions, comments? Oh, Director McNair.
A comment on behalf of the Violence Prevention Center grant application, just getting ahead of any questions that you might have about the public safety aid funds that were recently allocated to the Violence Prevention Center. I have a note from Lindsay, their director. Violence Prevention Center fiscal year 2025 starts October 1st, 2024, and we are currently projecting a deficit. The public safety aid funds will be used for our general operating expenses, personnel costs for 3 full-time staff, prevention programming, and a portion of our direct client assistance needs. If the Violence Prevention Center is to receive the funds from the Public Health Fund, we will use these funds to cover direct client assistance that will not be covered from the public safety aid funds, as well as the part-time weekend and holiday on-call advocate position.
Thank you. Okay. Well, if there are no other questions or comments, I'd entertain a motion here.
I move to accept the report. Is that
Uh,
specific enough? You want?
Yeah, the motion, I'm sorry, I just couldn't hear.
Oh, I was just making a motion to approve the report. You want me to
Or the
describe-
recommendations?
Recommendations, yes.
Okay, yep. Thank you, Rana. We have a motion to approve the recommendations. Is there support?
I'll support.
Thank you, Commissioner Sullivan. We have a motion and support. Further discussion? I guess for further discussion, I would just like to put a pin in the suggestion for, moving that, the funding in the future. I'd like to investigate that a little further. I really appreciate you bringing that up. I intended to anyways, and that just makes me want to do it more.
Thank you.
But thank you for that. Puts it back in front of mind. Also, just want to point out the difference between the requests total and our award total is significant. With this list of partners, there is both a lot of history, and then also, even with the innovation, there's some really solid partners that we are familiar with. And so I believe the needs are real, and the needs are great, and I would just hope that we look into the upcoming years at this difference and see if there's ways we can better address those needs from these organizations. But really appreciate the work on the committee. Thank you. And thank you, Commissioner Johnson, too, for your work on the committee. All right, any other questions, comments? Hearing or seeing none, all in favor? Aye. Opposed? Motion passes unanimously. Thank you. And we can move down to item 5B.
Thank you, Commissioner. Item 5B is a request to approve a use of fund balance to continue the child care wage enhancement program through 2025. We respectfully request that the Public Health and Human Services Board authorize a planned use of fund balance not to exceed $366,645 in budget year 2025 from the Public Health and Human Services Department reserves to continue county support for the child care wage enhancement program. Purpose of this request is to provide ongoing support to the local child care system, families, and the economic health of our community. Again, a little background here. In 2022, the Public Health and Human Services Board directed our department to develop programming and financial support to address our local child care crisis. In the 2023 and 2024 department budgets, this board authorized a planned use of fund balance up to $360,000 in 2023 and $366,645 in 2024. The purpose of the request in 2023 was to develop the child care provider wage enhancement program, hire a child care coordinator, and partner with the Economic Development Authority on a provider startup fund. We ultimately reduced the planned use of fund balance in 2023 following the reconfiguration of the child care and licensor position and following the receipt of grant funds from First Children's Finance. Public Health and Human Services also partnered with the EDA to secure $180,000 in competitive grant funding from the Minnesota Department of Employment and Economic Development to further strengthen our support for the local child care system. In 2024, Public Health and Human Services was awarded an additional $250,000 in funding from DEED to continue and expand the child care economic development initiatives in Cook County and Grand Portage through June of 2025. Northland Foundation has also granted an additional $31,000 to support unlicensed family, friends, and neighbor care providers and child care mentoring initiatives. These grants complement a cost of living increase that was included in the 2024 program budget to increase the wage for licensed child care providers to $5.79. Again, that's the supplemental pay that they are eligible to receive based on reported hours providing care to children. In addition, Cook County is participating in a mixed delivery action lab project through the State Department of Education, Health and Human Services that provides an additional $6,000 in financial support to increase collaboration and workforce development across early learning systems in Cook County. At the July 16th Committee of the Whole meeting, department staff reported on the initial 18 months of the wage enhancement pilot and other initiatives to address the child care crisis. Some of those early deliverables in the first 18 months of the program included an increase in 47 licensed child care spots, serving an additional 45 children in 2023. Also in 2023, there were an addition of 8 full-time and 9 part-time care providers to the workforce. Through June of 2024, we've also seen an increase in 22 new licensed child care spots through 2 new licensed programs, those being Northwoods Child Care in Grand Marais and the Birch Grove Seedlings Program in Tofty. The shortage of childcare and stability for the childcare workforce remains an issue for families and our local economy, with an estimated 75 to 100 spots needed to meet current demands. The First Children's Finance report that estimate comes from was enclosed in the meeting materials. Again, we're working to get as much information out to the public about our work in this area and have a dedicated page on our website with the reports, recording of the presentation on July 16th to the Committee of the Whole, different media outreach that Nancy, our child care coordinator, who is present here today and available to answer any questions that you all have about the request or our work thus far. This proposal will not impact the department levy request for 2025. The fund balance is sufficient to support this use of funds, and again, that fund balance analysis as reported at the August 6th special meeting is also enclosed here. The total expenditures for this year, 2024, are projected to be less than the $366,645 that we had allocated as a do not exceed amount for that use of fund balance, with the addition of $122,541 unbudgeted revenue from that deed grant. That's a state fiscal year that goes from 2024 through early 2025. We also have fewer wage enhancement hours than initially projected due to unfilled FTE and reduced hours at some of our existing licensed child care programs. Year-to-date expenditures for the wage enhancement program are at $197,288 of the total, again, just over $366,000 budgeted to use, or 53%. The 2025 budget proposal would allow for a modest 2.63 cost of living increase for providers, bringing that hourly wage enhancement rate to $6.11. We use that 2.63 cost of living increase based on projected Social Security cost of living estimates. Happy to take any questions that you might have about the request for a use of fund balance to continue support for this program into 2025.
Anybody have questions?
Just to clarify, Allison, over the last year, there was an increase of 8 full-time and 9 part-time providers?
That was in 2023, yes.
Wow, okay. And any anecdotal evidence that the supplemental wage funds had an important part in that increase?
If you would give me a minute, I'd be happy to tell you a little bit about what our providers have said. And I'm not going to paraphrase, I'm just going to read for you what they sent to me when I asked them from some of the different providers.
That's great, thank you.
Yes, so first, this is from Maria Carlson.
And by the way, this was not a setup.
Oh, yeah, no.
I was not prompted
No,
to ask this
perfect. I
question.
really appreciate it. Thank you so much, Commissioner, because I asked for some for some feedback from our providers, and then all of it got emailed like yesterday and last night. So I thought, "Ugh, how am I going to give this information?" So that was perfect. I will, give you some donuts or something later. This is from Maria Carlson, who's a provider here in Grand Marais. And she says, "This past year has been turbulent for my business as I had a full-time child and a nearly full-time child both move away, leaving empty spots. And finding 3-year-olds to fill those vacancies proved difficult. So I went the route of patching a few part-timers and looking forward to birthdays, and I was eventually able to enroll infants to make those part-time spots full-time. My father entered hospice last fall and soon after passed away, but I was able to be with him because I had a little wiggle room only because of wage enhancement funds. This was helpful for his quality of life and death and also my grief process. I don't think I would have fared as well had I not been able to share this time with my family and have a little stability in my business income. And for my program, I've been able to replace bedding and outdoor equipment for the children, add to our library new books, and find motor toys to enhance those skills. I am so appreciative of the wage enhancement, as I feel it really helps me provide consistent and high-quality care to our kids, as well as makes me feel like my community is behind the work that I do." So from Neva Maxwell, who is a Cooperation Station Board Chair, she said that Station Board of Directors are deeply grateful for the Child Care Wage Enhancement Program. This initiative has significantly boosted our staff wage and enabled us to keep our daycare costs steady for our families. Your support is invaluable, and we sincerely hope this program continues into the future. Thank you for your commitment to our community. And the others are right here on my computer that just went to sleep. I would just like to say that I know from talking to providers that especially in some of the organizations that hire employees, not just, private providers, that this has been one tool that they've been able to use to help retain their employees. And our committee of the whole, when I gave that presentation, to me, that was one of the most impressive numbers that we had to talk about, was the fact that we had not lost providers to other things in the community. We have lost, some moved away. But besides that, we didn't lose providers. They've been staying in their jobs, which is significant in this industry. So I'm going to read here from Hunter McLaurin. Sorry, I have a good friend with a similar last name whose first name is Hunter. It took me a second. So she says without the wage enhancement and grant funds that came from DEED, she would not have been able to open her program this early year. So from getting toys and all the furniture that she needed to be able to meet licensing requirements, she was able to open. And the wage enhancement actually helps her to be able to pay her rent, to be able to stay open in her program, especially as she was building her program and adding children to her spots. Maria Conlon, who also is a private provider here in town, says, "The wage enhancement program has helped myself and my daycare business significantly in the last year and a half because we've been lower on enrollment numbers for that preschool spot. It's been a help to fill that income gap so that we can keep the doors open and the bills paid. She truly loves what she does, and she feels blessed and fortunate that this program started and has been able to keep her afloat." She said we also utilize the DEED program, which is a little bit separate, but goes with these initiatives, for paying substitute hours, which helps to pay for their substitute. So being able to access that DEED program, they were able to take their first real family vacation since she opened this business. So often they go into early education or childcare field because we want to help, love, nurture, educate, and truly cherish those beginning years with these children. But when doing so, it's hard to find a balance with your own family because we're driven to put others first. So this has been a winning program for her childcare business because she doesn't have to be in a position of family not having somebody to care for their child, and for her not being able to afford a substitute when she needs to be gone. We kind of take that for granted, I think, with our jobs. So we might be able to, I can leave my job, I can do my work from home, or it'll be okay if I'm gone for the day, I will just do my work when I get back. That's not the case for a child care provider. If you can't be there, not only are you not at work, but 5 or 6 other families can't be at work or have to find other care, right? So finally, from Tammy Osborne, who is the infant teacher at the YMCA, she said, "For me, the wage enhancement is what's keeping me in this child care field. I love my work, But without the extra, I can't make enough to afford to live my life here. My infant room was able to be completely redone and have updated equipment thanks to some of the First Children's Finance grants we had last year. And a coworker moved here from Duluth because of the wage enhancement to work in our program. It's something we really need in order to keep childcare going in our community. So that's some of the feedback that providers sent to me and asked that I share with you about what wage enhancement is doing in their programs. And I'd be happy to answer any other questions. I know this is a very complicated subject. I know that we've been supporting this. It seems we've been supporting it for these last couple of years, and it's just something we've seen some steady growth. We want to be able to see that continued steady growth, and we really would appreciate that board support if that's something that you feel is important to our community as well.
Thank you. I would just like to point out that the wage enhancement program, correct me if I'm wrong, Allison, was an outgrowth of the discretionary grant funding, whereas we were getting requests from child care providers for funds, and we granted some for the first couple of years, and then that transitioned from being a discretionary funded project to a line item budget. So, because again, it's great for the community and essential. I did have one other question. The 75 to 100 more spaces that you project as being needed, it might be helpful to the providers if that could be broken down into an age thing, because the licensing depends on ages. So, we're projecting X many infants, and then, of course, once you get the infants, then you know that in 2 years, we're going to have X many 2-year-olds, and so
that
on,
the
and down
truth?
the
Yeah.
road.
And there's this little ebb and flow, obviously.
Yeah, sure.
And so please forgive me because I don't know the exact number, but I know that it's about 40 infants are born every year in Cook County, around there, 40, 45, I think is what I'm remembering. So we think that's just a little pod. And something that I am hearing from some parents in the community, parents who might be thinking that they would like to return to the workforce. However, it's very important that they find stable childcare before they do that. Because what if we hire a new person and they have childcare and then their childcare provider quits and then now this person has to leave their job? I mean, that affects employers, that affects workforce throughout the community. So I think that there are parents out there just waiting to make sure what we're doing in childcare is stable enough that they're able to take the steps forward that they need to have perhaps both parents join the workforce. It's a little bit of a trust issue that we're also trying to build in our community, that we are serious about this, about supporting this. And again, for anyone who wasn't here for that committee of the whole, I just have to say, the work that we're doing in Cook County is being noticed all around the state. I have people calling, I'm going down to speak to a whole group of people down in Hutchinson next month about what we've done in Cook County. And this is a significant investment because it is county-based. It's not just ARPA funds that we use, but the counties behind that. And it is eye-opening for other counties that, we could do something to support our families in a way that, and then we're going to need to find a way to make that sustainable, which is what our Child Care Solutions Committee is also working on for that. So kudos to the Board of Commissioners for supporting this so far and for all the work that's been done, because I know our child care providers really appreciate it. And I'm excited to see what we're going to be able to do.
Just to clarify, the discretionary fund, there were providers that applied in the discretionary fund, but the way I have it framed in my mind is it's more of a continuation of state funds that were set to expire, and those state funds were so critical for the operations of the providers that it really looked like a cliff if there wasn't further support. And so that's kind of my memory of how this kind of grew and began. And then there was a little bit of shuffling because there was providers that had received discretionary funds. So I'm not saying that's inaccurate, but I just had it framed differently in my mind. But I do appreciate how, that framing too. So thank you for that. And Nancy, thank you for your work, because we're just so fortunate that we've got your skills and experience on this team, and your passion and expertise, and without you, we'd be in a lot worse place. So it's a team effort, I know, but
It
you're
is. It really
a
is.
big part of the team.
Thank you so much, Commissioner Mills.
Mr. Chair. Thank you, Mr. Chair. I just want to echo something that Nancy said that I think is really important, which is we as an employer benefit directly from this program because we have staff with small children and babies at home. And they are frequently put in a position of having to decide, am I going to work or am I going to stay home? And often they don't have that choice because the spots aren't available. And so for us, especially for our difficult to fill positions, this makes a huge difference. And so I think, I applaud the board for supporting this. I think it's hugely important for the whole community, and I think it's the right thing to do. And the data are there. I mean, it's having an impact. We know that. So thank you.
Commissioner Starling.
Thank you. And in the West End, we just opened in the last month the little room for the babies through age 3. So I haven't met anybody yet because I don't seem to get the schedule that they have, but I'm hoping to get down there and meet that group. And there's a lot of moms been waiting for that. So we're open and ready to go.
Yes.
Commissioner Starley, thank you for serving on that subcommittee too, because, I mean, we need to keep innovating and keep improving, and yes, I really appreciate your work there, so thank you. Other questions, thoughts? My last thought, and I've said this before, of course, too, is I'm all in on this program. I think it's critical for our providers. I also want to recognize the cost for families, and I feel that we need to also try to do more on that front, but step by step, and this is the excellent first step, but I'm just hoping that we can provide more for the families, because we need the spots, and you can't have the childcare without the spots, but we also need our families to be able to afford the spots. It's a wicked problem, as they say, and I know it's not just in Cook County, it's statewide, it's nationwide, and I'm hearing similar rumblings that a lot of people are watching what's happening here and really impressed. As I mentioned before, the Deputy Commissioner, Department of Health, has raised eyebrows with that and impressed with what we're doing, and I think just as this gets more traction, I'm really hoping we're going to get more state support as well. And I mean, we'll see where the feds are. I haven't been following that as closely. It's a lot bigger pool and pond and all that kind of thing. But I think we can really build off our successes, and this is shown to be quite successful.
Thank you.
Is there a motion here?
I move that we accept the recommendation and funding.
Thank you, Frank. We have a motion. Is there support?
Support.
Thank you, Commissioner Starley. We have a motion and support. Further discussion. One thing it's already been pointed out, but this is coming from fund balance. That can't last forever. So we want to think about our longer term strategy as well, but right here, right now, this is what we have and what we need to do, in my opinion.
Commissioner, in just very broad numbers, just ballpark, what's the total county budget?
With all included, it's about $40 million. That includes transportation projects as well.
Okay.
Operating is closer to about 12.3, 12.4.
Okay. So we're talking about 2 or 3% of the total budget, total operating budget, much less of that than the total budget. Okay, thank you. Just want to get a ballpark.
Any other questions, comments? All those in favor?
Aye.
Aye. Opposed? Motion passes unanimously. Thank you very much.
Thank you so much.
Our last item before committee reports, our last item for board action is 5C. Approve the posting for the Children and Family Services Case Manager. Awesome.
Thank you, Commissioner Mills. Included in your agenda materials were some of the data that I presented within the August 6th special meeting of the Public Health and Human Services Board. I have also included a summary of all the questions and requests for additional information that were raised at that meeting. Again, I'm just going to walk through the summary right now. As reported at the recommendation before you today is to approve the addition of a full-time Children and Family Services case manager. As reported at the August 6th special meeting of the Public Health and Human Services Board, Children and Family Services caseloads are increasing dramatically. As of June 2024, work groups or cases within the Children and Family Services unit are more than double what they were in 2019, an increase from 33 in 2019 to 67 in 2024, and that again is year to date through June. Within that same time frame, the number of unduplicated children receiving services in these work groups has increased nearly threefold, up from 37 in 2019 to 108, again thus far in 2024. If approved, the position will be posted immediately. The position description for the 2 current and 1 proposed Children and Family Services case managers was enclosed in the agenda materials. The purpose of this request is to respond to an increase in maltreatment reports and the number of unduplicated children served across all Children and Family Services programs. The new position is included in the 2025 preliminary budget for the department. The estimated expense for this new position, if filled this year in 2024, is approximately $22,000. That estimate is based on a person coming on board in October. The salary and fringe, assuming full family benefits, is $20,730, with supply expense for a laptop and phone estimated at $2,000. We also anticipate an increase in child welfare targeted case management revenue and decreased staff overtime expense, neither of which are factored into the projections, but would further reduce the impact to the levy and fund balance this year. Savings due to turnover and vacant positions will offset the expense of this new position and overlap in onboarding a new supervisor through year-end. The July financial report indicates that the department is 8% below projections in salary expense, again due to prolonged vacancies and turnover. So I'm going to walk through the detailed analysis. The reason for the request was one of the questions raised on the 6th. Those reasons are to respond to an increase in reports of maltreatment and the number of unduplicated children served across Children and Family Services programs, to provide high-quality, consistent investigation and case management services, to provide early intervention services to prevent out-of-home placement when possible, and to maximize our ability to access state and federal revenue to offset the county cost for services provided. One of the questions on the 6th was what programs are included in the work group data that was included in the graphs. Those programs and the number of work groups within those program areas for 2024 year-to-date are as follows. Adoption and guardianship, we have 0 work groups in that area. Adult foster care licensing, 0 work groups in that area. Child care in general, representing 1 work group or case. Child care licensing, 9 work groups. Child foster care licensing, 10 work groups. Child Protective Services, 26, representing the largest number of work groups in that program area. Child Welfare at 13 work groups, and Parent Support Outreach at 8, bringing us to the total year-to-date work groups across Children and Family Services of 67. One of the other questions raised was how are those work groups distributed across the current staff within the Children and Family Services team. We have 1 employee with 29 open work groups. This is as of quarter 2, 2024. And the reason I used a quarter data is to have an apples-to-apples comparison with some of the statewide recommendations and data presented through another county in the state. One of our other staff has 33 open work groups as of 2024. Nancy, our child care coordinator and licensor, has 20 open work groups, and that was just pulling the data for those licensing work groups, as she doesn't carry a caseload in the same way that the two children and family case managers do. And then Rachael, our supervisor, has 6 cases assigned to her, bringing that total to 88. Again, there's a discrepancy here in the total open work groups by staff, as some staff are listed as secondary workers. So there is some duplication built into these numbers here. Also, some work groups have closed in quarter 2. So that's why it might not line up with the year-to-date figure. This question wasn't raised at the meeting on the 6th, but I thought it would be helpful context to bring to the board at the recommendation of one of the team members. What are the state mandates or recommendations for caseload size in child protection? The Minnesota Department of Human Services does not have a caseload policy for child protection. However, the Minnesota Governor's Task Force on the Protection of Children recommended that case managers have no more than 10 cases. Half or a third of what our staff are currently at. National best practices for child protection cases per worker are 12 to 15 cases for intake and 12 to 20 for case management. Ramsey County has a public data dashboard on their website that identifies the current caseload by quarter for their child protection staff. They identify a goal of 15 cases per worker as being in the acceptable range, and caseloads over 19 as very concerning. In a small agency like Cook County, our staff work across all areas of intake, assessment, and case management, so they do not have the same specialization as a metro county like Ramsey. There's a question about detail on turnover, vacancies, and the addition of new staff within Children and Family Services. I will walk through that as we get into the graphs in just a moment here. One of the other questions was around overtime data for 2023 and 2024. The estimates included in the board materials are based on reports out of eTime, which is our payroll recording system for county staff. I pulled the estimates based on the hours of comp time that are earned. So within Cook County, many staff are earning and using comp time rather than accruing overtime. So to provide a fuller picture of how often staff are working more than their assigned hours, 40 hours a week, included that comp earned. So for 2023, there were 232, just about 233 hours of comp earned straight. So that's compensatory time earned by our supervisors who earn straight time, as opposed to staff in CCEA of Cook County Employee Association who earn compensatory time at 1.5. For 2023, that figure was 265.5. Year-to-date in 2024, we are projected to exceed that considerably at 265.25 thus far. The total overtime and comp hours based on the eTime reports that I pulled were 600 in 2023 and 313 in 2024. The way that I came up with an estimated expense was based on the average wage of our staff and supervisor. So the estimated expense for 2023 was $28,800. Year-to-date 2024, we are at an estimated $15,000. Since I put this report together last week, Plowman was able to pull the actual payroll data for the department to provide the full picture of what the expenses are for overtime and comp time paid. A key component that was missing from my analysis was the leave payout when leaving employment, as that isn't included in our eTime reports. However, that is reflected in payroll reports. So I'll walk through those figures now. This is for 2024 year-to-date. Overtime paid, the total hours thus far are 98.5 hours overtime paid. This is across the agency as well. The total expense for those hours is $4,893. So that's overtime paid. That's assuming someone has maxed out their comp bank. Comp time paid for 2024 year-to-date, we are at 415 hours for a total expense of $16,161 and change. Perhaps the most surprising figure, maybe not surprising, but the biggest driver expense in this area is leave payout when leaving employment. So this is a significant financial burden that the county carries for staff who are unable to use their PL because they can't take the time off, because we don't have enough depth on the team, the workload is too high. People who are cycling through their comp earned and are carrying that PL balance year to year. The total leave payout when leaving employment thus far in 2024 is 1,219 hours at a total expense to the county of $53,241. So the total expense for overtime paid, comp time paid, leave payout when leaving employment for the department thus far in 2024 is just over $74,000, almost an entire full-time position. All right, so on page 55 of your agenda packet, I included, again, the child maltreatment report graph that was reported at the board meeting on the 6th. 2024 year-to-date, we're at 69 maltreatment reports received thus far. If we continue to receive new reports at the same pace as we have in the first 6 months of the year, we will easily exceed our 15-year high of 114 maltreatment reports in 2016. The volume of new reports typically increases in the fall when kids are back in school. In 2023, from January through June, there were 40 child protection intakes and then 50 intakes from July to December. Based on this projection, our year-end total could be as high as 150 reports. Open work groups across all children and family services. That is just the historical representation of that growth in caseloads going back to 2020, where we had 14 open work groups across all program areas. As of June 2024, there are 64 open work groups. Page 57 is, again, that unduplicated count of children in work groups. This is where we are seeing the most dramatic growth, with 104 children represented across all of those open work groups in children and family services through June of this year. That's an increase of essentially threefold since our pre-pandemic numbers of 37 in 2019, 38 in 2018, and as low as 16 going back to 2011. Staff hours for all children's services, including children's mental health. I included children's mental health here as a key part of the service provision and prevention for out-of-home placement and support to children, youth, and families in Cook County. This shows a pretty dramatic increase from 2010, where there were 1,955 reported hours, to our high in 2018 of 5,383 reported hours. Thus far in 2024, we are at 1,908. If we continue at the same pace of staff reporting, anticipate that we would exceed 2023 total reported hours. This is where I've provided the detail on staffing additions within children and family services, including children's mental health, as well as the factors contributing to a decrease in staff hours in recent years. So the last time we added a full-time child protection case manager was back in November 2015. This was in response to the governor's task force recommendation and allocation of additional funds to counties to support child protection staffing. In June of 2017, we added a Children and Family Services social worker. This was no new FTE, as we reclassified a case aide position to a social worker. We later backfilled that case aide position, so there was ultimately an increase in FTE there, but at the point that that was approved in 2017, it was FTE neutral, but an increase in pay grade for that position. In June of 2021, we again reclassified a community support worker position to a children's mental health case manager. In January 2023, we added a full-time behavioral health supervisor alongside the reorganization of children and family services into 2 separate teams, one for behavioral health services and the other with a focus on children and family services and licensing. So some of the factors that are driving that decrease in staff hours since our peak in 2018 and 2019, it's turnover and vacant positions. So in 2021, there were 8 positions turned over within the department, 3 of those in our small children and family services team. In 2022, there were 12 positions turned over in the department, 5 of those in children and family services, and a vacancy in child protection for half of the year, July through December. In 2023, we experienced our all-time high level of turnover with 14 positions, 3 of those being in children and family services and children's mental health. And again, that prolonged vacancy extended into June of that year, so significantly impacting the hours reported when that position was vacant for an entire year over 2 calendar years. In 2024, we have had 6 positions turn over thus far. None of those in children and family services. However, on the consent agenda today, we recognized with regret the resignation of our supervisor within this team. So one anticipated either this year or early next. And we also had reduced hours within the team from February through August due to family leave. All in all, since 2021, we have had 40 positions turnover within the department. I think it's important to recognize, however, that 30% of those positions turned over were due to internal transfers or promotions. So, not an insignificant amount. On 59 of the board agenda materials, I've included again that out-of-home placement expenditure report showing the very dramatic decrease in out-of-home placement spending and expense for the county, down from our all-time high in 2012 of $434,000 to this year to date, we are at $55,820. And we've seen again that significant downward trend, all-time low occurring in 2020 in the height of pandemic with just $49,577 expended. New in the materials is the graph representing child welfare targeted case management revenue. So this is the state and federal revenue that our staff are earning based on time reported in the social services information system, providing services and meeting monthly visit goals with children who meet this designation. The all-time high of CWTCM revenue received by our department was in 2018, $98,865. And this is just the amount that was retained by the county. This represents half of the overall revenue generated, with half of that going to the state. Thus far in 2024, our staff have generated and we have received $39,280 in child welfare targeted case management. So we are projected to exceed that 2023 amount of $61,167 easily. So the reason for including the child welfare targeted case management is to show that is not a direct relationship between the addition of staff and the cost to the county. As we have enough staff to do the work, they are able to meet their documentation timelines, generate revenue for the work that they're doing, and bring in additional state and federal funds to offset the cost to the county. Lastly, here on page 61, one of the team members generously offered some thoughts on how having insufficient staff and how specifically being the only child protection worker for a prolonged period during 2022 and 2023 has impacted her ability to support families and her hours that she's putting in at work. I'm just going to read through this here for the benefit of the public. So she's reporting that while she was scheduled to be out on PL, she would oftentimes work due to reports being received. She reports spending many nights working and one day each weekend on average to stay caught up on new reports and other documentation in SSIS. She did this for several months until she wasn't able to anymore and didn't want to experience burnout and need to prioritize time with her own children and family. She reports falling behind on case notes, that this happens consistently and could lead to delays in those targeted case management claims being filed with the state and reimbursed to the department. She reports accumulating a significant amount of comp time, which consistently put her over that 40 hours of banked comp time each pay period, which led to a large amount of extra compensation paid out each paycheck. She's not complaining about that, but it's important consideration to keep in mind, big picture. I have not used any paid leave this year, she's saying. All of my time off has been taken using my accumulated comp time and not my earned PL. The supervisor would often assist with entering child maltreatment report documentation in SSIS, as well as with required face-to-face child protection visits during particularly busy periods. This took time away from the supervisor's main duties. ICWA, which is the Indian Child Welfare Act, and MIFPA, which is the Minnesota Indian Family Preservation Act, documentation requirements were missed at times. Court documentation and timelines were also missed at times. There's potential for out-of-home placements lasting longer and permanency for children taking longer to reach, meaning the county pays for out-of-home placements for a longer period of time. New cases, clients, and families are not given all the time or attention that would have been beneficial throughout their cases, leading to cases taking longer to resolve, leading to families and children possibly being at greater risk of out-of-home placement, negative case outcomes, and more money spent on services for the family the longer the case stays open. Another factor she reports is that there's not enough time to network with and learn about the services of other local agencies and providers, and that it's very difficult to find time to train case aides on tasks that they could help with. So very supportive in terms of the same factors that I found in the caseload data, in the overtime data, out-of-home placement and expense. We did not coordinate that. But again, appreciate having that direct perspective on how this is impacting their work, their work-life balance, their service to families in our community, and some of the bigger picture financial impacts of not having adequate staff to meet the increased needs in our community. Again, that job description is included as an attachment. Our intent is to fill the position as a children and family services case manager so that we would have 3 FTE working within the same job classification. Long term, we might explore other ways to allocate those duties and have some specialization within the team, perhaps having an intake worker or a person whose primary responsibilities around the screening and convening of maltreatment reports, and other staff who are focused on case management. But at this point, our plan in the transition would be to have 3 staff working across all program areas to have that depth. Happy to answer any questions about the request or the information provided.
Thank you, Allison. Again, very sobering discussion and very, very important. My initial reaction, of course, me being me, and I know that you're much more thoughtful and conservative with your approaches, but is one enough? based on the data that I'm saying and the numbers that are recommended and our turnover, burnout, I'm just like, and like I said, me being me, but I think at least that step is what you're recommending, and I appreciate that, so, but the question I think needed to be asked.
I can just give some insight on my own approach to this, Commissioner, is that I was pretty humbled by the fact that I said we need to pause on considering any new FTE for the department, considering the turnover and the vacancy and the fact that we had a pretty significant transition in the supervisor and in the team. We had a case aide position vacant for some time that provides a great deal of support to the team in the area of ICWA and MIFPA compliance and notice requirements. It wasn't until I looked at the data for year to date that I saw just how dramatic this increase has been, and felt very confident about bringing this request for additional FTE for 2024 year to date.
But is one enough?
I think, yes, for now, we can assess how having an additional case manager impacts that workload distribution. I think having the time, once this person comes up to speed, right, because it's going to be a number of months, even if we are able to start recruiting for this position this year. It took an entire year to fill our last child protection case manager position. I hope that's not the case this time around. I hope we're able to fill this position this year. But I think with the time and space to be able to go through the cases and review and ensure that we're caught up on documentation, that'll give us a better picture of where we're really at and if we're meeting the needs.
Yeah, I forgot about office space too.
Office space is also a major factor. We don't have a workstation allocated for this position. It will require hybrid working arrangements, sharing of workstations, which is challenging in the world of child protection, where being together to be able to consult and problem solve and screen and approach things as a team is critical. But this team has, again, under Rachael's leadership, put a lot of infrastructure and processes in place to ensure that high level of coordination and collaboration regardless of where a person is working, if they're remote or in the office or on the other side of the office.
Thank you.
And is that a position that could be filled from home partly?
Yes, but by necessity, ideally, we would have a workstation for this employee within the department. So what I can envision is 2 of our more seasoned employees who have been with the department for some time sharing a hybrid work arrangement and workstation so that the new employee could have more time in office for their onboarding.
I'm sure it would require a lot more discussion, and maybe it's been explored already and I'm not aware of it, but just might there be appetite or potential for, appetite's the wrong word, might there be potential or willingness to have a county employee working in Grand Portage?
I've talked to Human Services Director Jackie Kozlowski about this. Most likely what that would look like is maybe a 1 or 2 day a week arrangement where we're utilizing their conference room space that right now is utilized several days a week by Sawtooth Mountain Clinic behavioral health staff. So I don't see that as a permanent solution, but I agree, Commissioner, that would be a great benefit to increase our presence within the Grand Portage community. We have staff traveling up there often to meet with staff or with families, but that wouldn't be a permanent solution. Similarly, having a satellite office on the west end is also something that we've contemplated. Birch Grove has a nice community center. We have staff that are traveling up from Two Harbors, Silver Bay, so that could be beneficial to staff to reduce their commute time and also have a greater presence throughout the community.
Mhm.
But all of this requires a lot of planning and
Oh, yeah.
logistics and contracting and ensuring that the space is confidential and secure, none of which we really have a lot of capacity to tackle at this point.
Yeah. Okay. Other questions, thoughts?
I'd just like to thank Allison for her very thorough response to our questions, and the fact that, we try to make our decisions based on data. You've provided us with so much information, and it's really heartfelt that I share my gratitude for all the work that you do, not just for gathering this information, but for your entire department, and appreciate it so much.
Thank you, Commissioner.
Yeah, I'm very impressed with the questions from this special meeting as well as the data provided, so thank you for your thoroughness there. Community members often ask me, why is Public Health and Human Services hiring at the rate that we have? And it's to respond to our community's needs straight up, and those numbers are staggering. Any other questions or comments, or can I get a motion?
I move we approve the hiring of additional child and family services caseworker.
Thank you, Frank. We have a motion. Is there support?
Support.
Thank you, Rana. We have a motion and support for the discussion. Hearing or seeing none, all in favor?
Aye.
Aye. Opposed? Motion passes unanimously. Thank you.
Thank you.
We have
Anything
about,
else?
yes, please.
One
Commissioner
question. To Allison, what percentage, it's like you are burdened with paperwork and reporting, and what percentage of working with a child, or what percentage actually is interactions with the recipient, and what percentage goes to filling out paperwork, telling the state or whomever what you've done?
It's an excellent question, Commissioner. I don't know that I can provide an estimate right now, but I could share a recent Star Tribune analysis on countywide, or statewide rather, how the deficiencies in our documentation system that's mandated for all counties, how that creates that administrative burden for staff because of the lack of functionality within that system. So I'll follow up with that via email after our meeting.
That's a good question. We only have about 3 minutes here, and I'm going to ask that we hold off on committee reports unless there's something that absolutely needs to be shared. And then I welcome it, of course, and I'll leave that on each of our judgment. So does anyone, please,
I
Commissioner
would
Johnson.
like to share something.
please.
I attended AOA transportation meeting. It's not one of my committee assignments, but Grace let me know about it. And I had the opportunity to discuss AEOA transportation and the lack of resources here in Cook County compared to what we need. And I want to share that out of that meeting, they're requesting, even though you call Dial a Ride and you're out of the service area, call anyway, say you don't want to ride, because they need to document that we have the needs outside of their very small service area. And they are working on updating brochures to be more clear about that, but if anybody knows people who have been declined, please call again so we can track that information. So I'll share that.
That's very powerful. Thank you.
Dial-A-Ride is available to anybody, or are there age or income restrictions?
It's available to anybody, but within their small service area.
Got it. Right. Thank you.
We're hoping to show that we have a greater need
Yes, correct.
Yeah.
Actually, that exact thing came up at our Gunflint Lake Homeowners Association meeting on Friday. Someone was requesting, why can't we get AOEA? Nobody knew.
Thank you for sharing that. Anybody else? Then we'll move on to item 7, which is adjournment, and we are adjourned. Thank you.
And the EOA meeting tomorrow, no, tomorrow. It's Maryland. And